Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. It's great to be back. I am Mary Alale Yusuf. Some of the things that make for easy movement are healthy bones. A fractured bone would make function difficult. Fractures are cracks or breakages in the bone. These are more likely to happen in older adults. Most occur when a bone is impacted by more force or pressure than it can support. Worldwide, osteoporosis causes more than 8.9 million fractures annually. According to the Foundation for Osteoporosis, of the estimated 9 million osteoporotic fractures in 2000, 1.6 million were at the hip and 1.7 million at the forearm. With me in the studio is a consultant orthopedic and trauma surgeon from the National Orthopedic Hospital, Igbobi, in Lagos. Dr. Chongjo Choji, you are welcome to the show.
Glad.
Could you tell us if we have different sorts of fractures? What are they?
Yes, wherever you have a bone, you could have fracture, just as you mentioned. And these various fractures, based on location, have different characteristics. So you could have long bone fractures and skull fractures, fractures of the vertebrae or bones of the back, neck, the pelvis, the hip.
Sometimes I hear people say somebody has multiple fractures.
Yes.
And sometimes they say simple. What does that mean?
Well, it's the concept of polytrauma. Because when an injuring force or a noxious agent comes in contact with the body, it dissipates its energy without bias. So say, for example, you're involved in a motor accident. You could hit virtually anywhere. So you could come with fractures of the long bones, fractures of the pelvis, a spinal injury, which is basically injury to the vertebrae. And well, generally the concept of trauma is such that we try to first and foremost keep these patients alive.
Is there a difference between a fracture and a sprain?
Yes, sprains generally are with regard to soft tissue injury. They're related to soft tissue injury, but fractures are bony injuries.
Okay, so fractures would involve bones.
Yes.
Sprains would involve muscles, tendons.
Yes.
Okay.
Ligaments and tendons.
Are there some people who are more at risk of getting fractures than others?
Well, yes. Well, I would say if you look at sex, the male sex is much more outgoing. We do more risky things.
Fall more.
Yes, fall more, and so we have a higher propensity to sustain fractures than others. But as we move around in our globalized and industrialized world, as you fly on a plane, as you move around in cars and all kinds of things, injuries are bound to occur as a result of accidents from time to time.
What's a spinal fracture? You mentioned that. You said vertebrae.
Yes.
Is it much different from other fractures?
Yes, what makes it unique is because the spinal column itself encases the spinal cord. So it's not just injury to bone. The vertebrae are generally bones stacked on top of each other, like a stack of coins. And it's a composite structure. It has ligamentous components as well. And they each have holes in them. And when they are stacked together, they form a canal for the spinal cord. And on the side, you have exits for nerves that issue out from the spinal cord. So because it's bony and unyielding, any little displacement or even collection of blood as a result of a fracture could impinge on those neural structures, and they have implications for recovery. The patient could be paralyzed, could lose function, will be unable to use based on the level.
Just because of a fracture to the bone?
Yes.
Not particularly the nerve?
Yes. That causes secondary injury to nerves.
Okay.
So if there's a shift, for example, that will cause compression, and that will lead to problems.
Now, let's assume somebody sustains a fall, one of the reasons for fractures, and there's cause to suspect that he might have a fracture. What do family members do? I know they take him to the hospital and all that, but how do they take him to the hospital? Or what can they do before he gets there? Because, I mean, it's the sad truth that we don't really have ambulance service the way we ought to.
Well, when the patient sustains a fracture, for most fractures, especially long bone fractures, it would be obvious. There usually will be deformity, very exquisite pain that is worsened when there's movement, and there will be swelling. So the thing to do is to support as much as you can. People improvise using various things. We see patients coming with cartons and all that wrapped just to help. Some would tie a stick around the limb and secure it with cloth and all that. There are various things they could try, but for spinal injury, what's actually advised is that the patient has to be moved very carefully so that you do not injudiciously cause injury to the spine as well. So he must be log rolled, but people have to be trained for that. And that's where the need for public enlightenment comes in.
But a normal, everyday person, can that person be trained for such a thing? I mean, just a regular brother or sister in the house?
Well, it's just for them to be told to, not to do harm.
And keep the person as immobile, or the parts
as immobile as possible. If they could carry him as he is, it would be better. If they could get help, we see Lagos is much better than other states. The emergency medical services are at strategic points around the city, so they are better trained for that. So if you suspect, especially when the patient does not have any flicker of movement, it's advised that you keep him still and try as much as possible to get someone who is knowledgeable enough to help. Because in trying to help, you could worsen his problems.
The situation.
Yeah.
I see people sometimes with a cast, that white, what they call it, POP, on their leg. Is that the only method by which fractures are handled?
No, there are so many methods. That is just to help to keep the fracture in the right position, to keep it aligned so that it heals in the proper position. But there are other methods as well, not popular in the public. That is done in a hospital.
Okay.
When a patient arrives, there are various forms of intervention. We may use external fixation. We may put an implant within to hold a broken bone.
You mean like real nuts and bolts inside the bone?
Screws and plates to secure the fracture.
How does, because I'm trying to imagine maybe somebody who had an accident and has a bone broken in several places at once, like pieces of bone. Can that be salvaged?
Yes, it can. There is what we call the bag of bones technique. So it's basically like a bag of bones when it comes pulverized, so to speak. And when there's an open wound and even bone spicules are lost.
Bone
spicules.
Spicules.
Yes, you have a whole segment of bone extruded and lost. That is salvageable too.
Thrown out of the body.
Yes.
That must be excruciating.
Yes. He has bone loss. Thankfully, with advancement of technology and better understanding, we're able now to reconstruct even lost bone.
With some sort of material other than what you get from the body?
No, the patient's own biology. Yes, we create a second fracture. We mount a frame and we control movement.
Okay.
So the body itself generates unlimited quantities of bone.
Bone grows?
Yes, so it's called bone transport. It's part of the Ilizarov technique. And so when you create a special fracture in the theater, through your frame, you move it at a certain rate across the gap where the missing bone fell out from, the defect it fell out from. And then it now docks. Just a simple word, docking. The bone you are transporting across the gap docks on the further bony fragment, and then it leaves a trail of new bone. So by the time it heals, the docking site heals, the new bone formed. They all form one single piece of bone after some length of time.
Can a person regain full function of the part of body that bone is supporting after it has been fixed?
Yes, that is what our work is all about, to return the patient to his pre-injury state.
I see many old people, they don't seem to ever regain full function. They, the limp, and it's just a picture, of an old person like, oh, when you get to this stage and you fall, that's it. You'll never be the same again.
Well, for old people, they have what we call fragility fractures. And that happens because of osteoporosis, as you said, more so in women than in men.
So this osteoporosis is reduced bone density, right?
Yes.
So the bone is not as thick.
It's more fragile.
Okay.
Yes. So with just a little force, say they just trip on the carpet and hit their hip, which is the most common, the hip, and then as they try to break the fall,
the forearm gets it.
The distal radius.
Okay.
Yes. For them, you see, for the hip fractures, it's believed to be a terminal event. If it's not addressed on time, it will be a terminal event. But it's a host of issues for Nigeria because many patients pay out of pocket. And one reason why they stay away from hospitals is because they're thinking of cost.
Yes.
They're thinking of cost. So they would rather go to a traditional bone setter. If we had health insurance that covered some reasonable cost, I believe people would present earlier. And that's why you see some of those poorer outcomes. Sometimes we have even those who come early, but they don't have funds.
Okay, I would love to address the issue of the bone setters, but let me first ask you, how does having a hip fracture result in a terminal problem?
Okay. Well, that is because the person will be lying down for a long time. We call that the problem of prolonged recumbency. And when you are in bed for so long and you're not very active, you are prone to several problems. One could develop skin problems. The skin breaks down, especially if you're lying on a spot for a very long time. That gives rise to pressure sores which could get infected. The patient is prone to orthostatic pneumonia, deep venous thrombosis. All those are killers.
So infection as a secondary cause.
Yes, as a secondary complication.
Complication,
yes,
is what leads to.
Is one of several.
Okay.
Yes.
We'll come to others, but we need to take a break.
Okay.
We're going to take a short break. Stay with us till we come back on the other side. Welcome back. Please tweet at CTV_Mary A for questions about fractures. You can also call at 08085 468 3514. That's 0805 468 3514 for any questions on fractures. We were going to talk about bone setters. Now, people say that they go to bone setters because they are scared that the doctors in the hospital are prone to chopping off their limbs. Are these fears unfounded?
Well, I think it comes from misinformation and lack of understanding of the facts. And I wouldn't blame them because they don't know better. Trying to veer away from controversy, comparing our practice to traditional bone setters. We seem to have acquired some notoriety, especially at the orthopedic hospital, for amputating limbs. But that's as a result of complications patients come with.
Okay.
Say, for example, a patient has visited a traditional bone setter and comes to us with gangrene. that limb is a danger to the patient. It's like having a corpse attached to yourself with your blood flow, blood flowing between you and the corpse. You know, infection will come into the system, and that is what is likely to kill that patient.
Okay.
But we would never do an amputation against the patient's will. The patient will be informed, and he will have to make the decision. It's entirely his, and his life depends on it.
Okay, so what can they do to avoid getting a gangrenous limb?
Well, it's all about splintage. Like I said, not every fracture is amenable to splintage as is practiced by the traditional bone setters.
And splintage is putting something...
Yes, tying wood
and
or
tying
something.
the limbs to it.
Yes.
Okay, so is that a problem sometimes?
It is a problem, especially when it's applied too tight. It cuts off the blood supply, you know, further down, and the leg dies off.
Okay.
Because it has no blood supply. And then other problems that could arise because of that is, say for example, he has a fracture around the joint, and you put that splint, that joint is going to be stiff. Those are called periarticular fractures, fractures around joints. They are special fractures.
And they are not to be splinted?
They are not to be splinted that way.
Okay.
The principle of treatment in those kinds of fractures is to perform surgery as soon as possible. And to achieve anatomic reduction, you want the joint to be seated as it was before injury. You try to reconstruct that surgically. And then if you're able to achieve that, you want to start moving that joint early. So if he has gone somewhere else and the limb has been splinted, he comes with a stiff joint. That joint is not salvageable because it's a lost opportunity. Yes, it didn't present.
So would you then say that most bone setters are not flexible enough in their treatment patterns?
I don't know what they practice. I am only speaking from my own perspective.
But you do see some of these people come to you.
Not just
from
we
there.
see a lot. And even for those who don't suffer, say, a gangrenous limb, they come very late. They come with malunions, and that's why you see people limping a lot and all that. And all maybe they needed was just a cast. And even the cast, if you're not trained, you wouldn't know where to stop. Even a cast using orthodox care can cause those complications. But because we are trained, we would not put a full cast, for example, if a limb is grossly swollen. A patient comes with a fracture and we want to immobilize. We put a provisional cast. We call it a back slab. Yes, it will pout open when there's additional swelling. So that takes off pressure. It allows blood to flow.
So it allows the body to breathe, essentially.
Exactly.
There's this other problem, though. People complain sometimes that, you know, somebody went to the doctor, they had to put something around his leg or his arm, and because of that, he's now limping. One limb is shorter than the other.
I'm trying to understand what was put around his arm.
Well, you know, these are people who don't understand the medical terms, but they feel that, oh, since my child went to the doctor, one limb, one leg is shorter than the other.
For children, it's a bit special.
Okay.
Yes, because they're growing. And then theirs is not just purely a fracture, but they also injure the growth plate. So if a child, for example, injures the growth plate around the knee, subsequently there will be shortening. There might also be deformities, all kinds of deformities in different places.
And there's no way of avoiding that?
Well, if it's injured, it's injured. You cannot make it recover. Yes, you only watch and see, watchful waiting, and you manage based on your expertise and how best you can, and subsequently you address the problems. We correct deformities as well. Yes, using the same Ilizarov technique. All kinds of angular deformities in all kinds of bizarre planes. Yes.
So if somebody has stayed maybe a bit too long after there was a fracture, and bone fuses, and there's a deformity, you can correct that. But before you answer, let me take a call. Hello?
Hello.
Hello. Welcome to the show. What's your question?
Hello?
Hello, we can hear you. Go on.
Yeah. Hello, madam. Good morning.
Good morning, sir. We can hear you. What's your question?
My question goes down. Now I'm joining. It's not in this channel. So I want to know the headline before my question. Please help me.
Could you put off your TV? It appears to be interfering with sound. I think we've lost Ndubisi. Anyway, so we were talking about deformities. Can you correct that? Maybe somebody comes a bit late. There's no infection, but the child is deformed.
That's correct.
And then restore full function also.
Well, full function may not be achievable. And that's why when they come to us, we tell them what is realistic. We try to match their aspirations and expectations.
So you're able to give them
reality.
a realistic prognosis.
Exactly. So if he has an injury that extended to the joint, for example, that joint will be arthritic. There's already an insult to the joint. And if it was a very bad injury, there's nothing to do to salvage that. So long term, the good thing is that there is always an option further down the line. When you have an arthritic joint, say in a child, you wait until he's fully grown, and then maybe when he's middle-aged,
You fix it.
we can correct deformities, but then the joint problem can be fixed much later with a
We
joint
have another call
replacement.
coming in. Hello.
Hello, good morning.
Good morning, Beatrice. What's your question?
For somebody who did not fall, or none of study in this test, they said he has a lumbar spondylitis. Is it the bone that is affected or the tissue?
Thank you very much,
Thank
Beatrice.
you. Well, it's not a fracture, so to speak.
What does she call it?
She said spondylosis.
Okay.
It's degenerative disease of the spine, and that can lead to weakness of the lower legs,
Okay.
of the legs, and also some sphincteric problems. People could begin to defecate and urinate on themselves uncontrollably. And for that, he will need some decompressive surgery.
And does that also go to the trauma surgeon?
Yes, it comes. You come to Igbobi, we have all kinds of subspecialties there to address all these problems, any musculoskeletal problem.
After the surgery has been done, can it be returned to the normal function?
Yes, if the person comes early enough.
Okay, so Beatrice, that's for you. Let's see whether that can be fixed. Now, if a child has, should I call it a fracture? You know, a bend. Let me just call it a bend. Because sometimes it doesn't really break.
Yes.
Can the child still grow normally in that limb?
Well, I guess what
Because
you're
I
talking
know,
about is
especially for a girl,
Okay.
you know, they wouldn't want to be limping just because they had a fall or an accident and the limb didn't completely break. Let's take this last call before we go to that question. Hello.
Oh, good day.
Good day. Is that Opeyemi? What's your question?
Yes, I'm a victim of an accident. Even till the moment I'm on bed. So,
Sorry, could you put off your TV? Put off your TV.
I was living at Igbobi for about 9 months admitted. My hip is still on. After the treatment in Igbobi, I still have pain in my hip. I'm 73 now, and I'm still on bed. I'm moving on a wheelchair. Someone is telling me that there could be what they call it, when you replace the bone resurface. Is this possible? And for me now, I'm afraid of wanting anything on my body, any pain or anything anymore. I've been on bed for a very long time.
Did you get that? He's 73.
Okay.
I think he has a plate somewhere,
Okay.
and he's been bedridden for a long time.
Well, I wouldn't know what his problem is. It may be a multiplicity of problems. He may have neural problems as a complication. And that will depend on, the person treating him. But I guess there's always an option for him. Once he's not fully paralyzed, there's always
Okay.
an option for him. Something can be done.
We're out of time, but I want to give you 30 seconds to say what kind of habits can we adopt for healthy bones?
Well, first and foremost, you look at what caused these injuries? How are they sustained? A lot of them come from road traffic accidents. A lot of them are work-related. So a lot of them are, sustained during pastimes.
Okay.
Your hobby and all that. So, well, if you're a sports person, you protect yourself. Shin guards and all that. If you're at work, wear a helmet, wear all kinds of protection. I'm sure in various places they have protective equipment. And also on the roads,
drive carefully.
Drive carefully. We should be licensed properly.
We really have to go now.
And then the
Thank
roads
you
should
so
be
much.
made worthy.
Thank you so much for coming to the show. That was so interesting. And thank you for being with us and calling in. Beatrice Ndubisi Openiyi, your calls were very much welcome. Have a wonderful day. I am Mary Alale Yusuf.